Just gave the numbers for last night. 1,713 deaths, 455 in hospital, and I think it's a 37 or 39 in ICUs. Has there been any update on that, or any increase in numbers that you can tell us of?
Yeah, sure. Well, just if I can confirm, the hospitalised numbers this morning with COVID positive patients is 491.
So
And
that's
just
up
put that in
40 odd since
context.
yesterday.
That's up since yesterday, and just put that in context, we had just reached below 200 at 198 sometime around the middle of December, and it's actually doubled in a week, so more than doubled now in a week. So
Any
it's
more in
extremely
ICUs?
concerning. Yeah, our ICU this morning, just as first thing this morning, is at 39. And particularly in ICU, what we are seeing, they're the numbers in our ICU units, but we are seeing over the last few days in particular, increasing numbers of people who would need what we call advanced respiratory support. So they may not be in an ICU unit, but needing some oxygen and ventilation. So that's quite a concerning trend for us, so not just an ICU, not just a hospitalised case, but needing respiratory support. So that is concerning, and the rise is very significant for us. And on the numbers that you just said, in terms of the cases yesterday, I think that was a very sombre and poignant number that we unfortunately have experienced at over almost 1,800. And what I expect to see today is that rapidly rise once again. From
Well,
what
it's
we've been
doubled.
looking
It
at going
doubled
through
from the previous day. Sorry, Paul, but doubled from the previous day. We're not. We couldn't possibly see that number double again today, could we?
There's a strong likelihood that the trends that we're on, you could actually see that certainly double in the next few days, if not today. So that's the extent of what we are seeing. And I don't like to bring this message always to the public how serious it is, but I have a responsibility to do it. And that is the level of transmission, that is the level of growth of increase in the virus on a daily basis that we're seeing, which is, as I described, at really alarming levels, and at a level that is at high risk for everybody. So, if I can just put in context, some of the centres that we are testing in, overall we said yesterday our positivity rate is about 10%, that's nationally. But there are days, there's been days just this week where it's 20%. Some of our testing centres in the country, we're seeing between a 25 and a 50% positivity rate coming through the test centres. So we are at alarming levels, and I can't put any more stark, unfortunately, than that. That's the rate of transmission in the community.
Tony Holohan, sorry, Paul. Tony Holohan was on with us earlier, and we were going through those numbers. But there is one set of numbers actually that scares me more, and it doesn't seem to be getting the same doesn't seem to be highlighted the same way, which is that hundreds of cases. You're getting 100 cases a day with 20 to 30 close contacts. Now that potentially is 2,000 to 3,000 infections a week of that, and the health service is overrun.
Yeah, well, if you take just what you described there now, the combination is what really hurts us. So, first of all, a high level of cases, and we've seen those numbers. Secondly, the growth of rate of the cases, and that's what's happening. Thirdly, the positivity rate, and I've just outlined here what we're seeing. And then fourthly is the number of contacts and we say the average number across the country is 6. But certainly this week we've had days where there's over 100 people would have had between 20 and 30 contacts. And we are seeing, and I've heard some of the GPs talking about it, entire families coming in for testing, and significant numbers of that family then being identified as positive. So it is at a rapid rate of transmission. It is at a rate now that we need urgent support and urgent action by all of us, every individual in the country, particularly in the next few days. The growth levels it's at means we all need to retract from any plans that we had, any New Year's Eve plans in particular that we had. And when you're out, you're at risk. It's as simple as that. When you're mixing, you're at higher risk. If you're mixing with people outside of your home, you're at extreme risk. And if you're mixing with a number of people indoors, you're at high risk again. So they're the factors. Everything that we know about the disease this year is proven on all of those factors.
What is your message for people listening this morning? And make it as honest and as stark as you can.
Yeah, first of all, I think everybody wants to regain everything that we cherish about life in Ireland here. We're all very proud of it. It's the spontaneity, it's the socialising, it's having the crack. we will get that back. That's what 2021 is about. And I'm certainly really proud, being in the role I'm in, but I'm proud of the very response that we've got from the public throughout this year. I'm very proud of our staff and the response that they've made this year and the sacrifices they have made. So my big message is, look, bear with us, stick with us, stay safe, and we will get there.